They'll give you a
He's a
back.
Christian, but he's from a Muslim
I can't
country.
just right now.
Well, I know, she had this.
I got recruited, but I knew this
But I
job.
saw him with.
Okay, if you would all rise for our invocation. Chaplain John Gare.
Would you bow your heads with me as we pray?
Lord our God, we gather this afternoon mindful of the recent passing of what we call Valentine's Day. It is a day we celebrate with thoughtful expressions of appreciation and affection towards those we love. And with the lingering thoughts of love in our hearts, we are reminded of the importance of being loving towards one another. We are also reminded as we begin this meeting of our hospital board that it is written that we should love our neighbors as ourselves. We have many neighbors in this county, our community, and we thank you for the weighty privilege we have to love and serve them in their times of greatest need. They come to us in crisis, they come to us in pain, and they often come to us in fear for their very lives. So help us, we pray, to bring our neighbors healing, to bring our neighbors comfort, and to express our personal human compassion and our genuine love for them in their hours of greatest mortal need. Bless this, our hospital board and our administrative leaders as they guide this great institution to love our neighbors as ourselves. These things together we pray. Amen.
Amen. Now our Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So before we begin, I would take a moment just to have the pleasure of announcing that Britt Reiner, who is a member of this board, and her husband Noah had a baby girl on February 12th, weighing 7 pounds 4 ounces, measuring 19 3/4 inches in this hospital. Her name is Paloma Reiner, and we congratulate her on that significant addition to her family. So, with that, I will call the meeting of the Sarasota Public Hospital Board to order. I need to read a statement about public comments. Any citizen desiring to address the board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Next is the approval of the orders of the day. So if I could get a motion.
Mr. Chairman, I make a motion to approve the orders of the day.
Thank you. Second. Okay, we have a motion and a second. Any discussion? Hearing none, all those in favor, please indicate so by saying yes.
Yes.
Any opposed? The motion carries. Thank you. Next is approval of the minutes of the meeting of January 20th, 2020.
Mr. Chairman, I move approval of the minutes of last month's meeting.
Second.
Okay, thank you. We have a motion and a second. Any discussion? Hearing none, all those in favor of the motion, please indicate so by saying yes.
Yes.
Any opposed? Mr. Henry is opposed. The motion carries. Next are board reports. We do not have any board reports for this meeting. So we'll move on then to our physician speaker, and Dr. Schulman, I believe you have an introduction.
Thank you. It is my pleasure to introduce Dr. Yaryur, a very well-known face and name to our hospital, for a subject that we are increasingly hearing is the abbreviation TAVR, Trans-Aortic Valve Replacement Procedure, and we welcome that discussion.
Thank you. Thank you for having me here today. Transcatheter aortic valve replacement was approved in the United States by the FDA in 2012. And that's when we started our program in the latter part of October of 2012. And up until now, essentially 6 years, we've done over 1,000 cases. We're one of the fastest growing programs in Florida. We're the second busiest right now. And TAVR is a procedure that's done for people who have what's called aortic stenosis. Aortic stenosis becomes a very common problem as you age. It's an aging process and degeneration of the valve, but it could also be congenital. Some people are born with 2 cusps rather than 3 cusps, as it's being shown on this diagram. And another form of aortic stenosis can be created from radiation therapy or inflammatory processes. The procedure that we offer now is either to have surgery, TAVR as an option, or medical therapy and conservative management with palliative care. If you look at long-term survival of somebody who has aortic stenosis and symptomatic, their survivalship is less than many of these cancers that's outlined here over a 5-year period. So it's worse than lung cancer, breast cancer, prostate cancer, and ovarian cancers. If you have symptoms from aortic stenosis with congestive heart failure and it's severe, 50% of the people die within 2 years. Everybody dies within 4 years. If the aortic stenosis is critical, 50% of the people die within 6 months. So when we started our program, the FDA had approved it for inoperable patients or high-risk patients. And a lot of patients actually came out of hospice because that's where there was no other options for them except for medical compassionate care. There's currently 3 valves available in the United States to implant in these patients. One's the Edwards valve, which is the one on the left. It's a Medtronic valve, and most recently, the Boston Scientific Lotus valve. The Lotus valve, however, is restricted right now, at least, to only high-risk patients, where the other 2 valves are approved for also low-risk patients. And when we talk about risk, it's based on surgical risk for death. So a low-risk patient would be somebody that if they underwent surgical aortic valve replacement, the risk of death would be calculated to be less than 3%. If the risk of death is between 3 and 7%, it's considered intermediate risk. And if it's over 8% risk of death, then it's considered to be high risk. One of the complications of TAVR that's concerning to many people and ourselves as the physicians doing this procedure is the risk of stroke. Most of my patients will tell me they prefer to have a heart attack than a stroke. So we're trying to find ways to mitigate this problem, and one of the ways is to put filters. And there is one filter approved right now by the FDA called the Sentinel device, and we are using it in this hospital. It's not the best device out there. There's got to be, hopefully in the future, better designs and better filters. Because of the volume in this hospital and because of our interest, and we have attracted the industry to look at our hospital, we're actually going to start an enrollment in a trial comparing filter versus no filter in all comers to the hospital for transcatheter valve replacement. The team is composed of interventional cardiologists, the top 4, Dr. Schreiman, Dr. Muma, Dr. Iturralde, and then the surgical team, which is Dr. Sal, Dr. Hopper, Kelly, Vasco, and Fong. But it's a setup of technicians, nurses, and probably the heart of our program is Pat Conant, who's our valve coordinator. She has to coordinate everything and make sure all the T's are crossed and all the I's are dotted. This is just an illustration of where TAVR is done. It's done in a hybrid room. I wish we had 6 of these because we could do more cases. But it's an elaborate procedure. When we started this in 2012, the first case took us 3 hours. And right now we're averaging about 35 minutes a case. We used to do surgical cut downs to the groin. Now we do all percutaneously. 95% of our cases are through the groin. We used to have our patients be admitted to the intensive care unit. Now they leave the next day. This is showing our volume, how we started in 2012, but that's the latter part of October. 2019, we had a slight drop. The reason for the drop is several reasons. One is we have competitors now. Venice Hospital is performing the procedure, and Port Charlotte has recently started their program as well. And of course, up north, we have Blake and Manatee counties are doing the procedures. Right now, we've done 44 cases. We're probably going to be hitting about 300 this year, though. It's important for the community to understand some of our patients, or many of our patients, are now coming from out of town. They're not all from Sarasota, and many are from the up north. And actually, we've had some patients refer from the Cleveland Clinic. The length of stay has changed. Initially, it was quite high, but I'll tell you the reason it was high. It never made sense to me, but Medicare would reimburse more if the patient stayed in the hospital for 4 days or longer. It was crazy. So we had to find an excuse to keep them, to get reimbursed. Otherwise, it was costing us money. Now it's the opposite. Now they want us to get the patients out. And we do a very good, we're one of the top in the nation about discharging our patients early. This is a chart of showing what happened from 2012 to 2019. The average age of our patients still has remained unchanged, roughly 81 to 82 years of age. Our length of stay went from 5 to 1.8 days. Going from the intensive care unit from the cath lab up to a recovery area now on the floors, 97% of our patients will go to a regular telemetry floor, a stepped-down cardiac unit. Our pacemaker implantation, one of the risks of the procedure is to need a pacemaker. In the country, runs around 10 to 15%. We're down to 5%. Stroke risk, as you can see, is not high, but still is too high in my opinion, and that's why we're working with filtered devices and try to find ways to mitigate this problem. A one-year mortality in the country, at 1 year, is roughly around 20 to 22%. Last year in our hospital, or in 2018, because you have to wait for a whole year to get the data, is 11%. Other things that we can do with transcatheter aortic valve replacement is transcatheter mitral valve replacement. So we are actually also doing procedures where people have had previous surgery on their mitral valves, and we can put the same valve in the mitral valve position, and that's avoiding them to have their resternotomies and opened up. And if patients have had mitral valve repair with a ring, the same thing can be done. Barriers to our growth, this hospital, we're outgrowing, and we have been for a while now. It's become difficult to get time to do these procedures. We lack sometimes the staff, and it's been difficult sometimes. Some of our obstacles is with anesthesia to get coverage. But you can see our volume has increased by 160%, but we still have the same amount of staff and the same amount of rooms. Right now, unfortunately, I'm sad to say that we have 60 patients on the waiting list. And that's a little bit too long. We've had the industry and the country has looked at our program because of our efficiency and how we work, and we do a good job, but we're still very limited on how we can get some of these cases expeditiously done. In the country, they're demonstrating that some of these patients are not dying because of the procedure, they're dying because they can't get the procedure in a timely manner. We still keep our patients waiting less than 4 weeks, but with a 60-patient waiting list right now, we're obviously going to have patients waiting over 4 weeks before they can get the cases done. And that's this is just some of the indications of why we do the procedure, but overall we're doing great. I think we can still do better, and hopefully with some growth and more support staff and anesthesia, we can accommodate our patients. Thank you.
Thank you, Doctor. Any questions for Dr. Ura?
How much does a valve cost?
So roughly, they're all about the same. They're roughly right now, I think we're paying around $31,000 for a valve, where a surgical valve is $4,000. But when you look at the cost of the procedure versus surgery, long-term, within a year, it's much cheaper still to have TAVR over surgery.
And insurance usually covers it?
Yes, it does cover it. Except, obviously we're having some difficulty, I think, with a couple of insurances are a bit of a problem, but generally this is a covered procedure. Yes.
Any other questions? Oh,
I
Sharon.
just have a comment. I saw you on TV last week, I think it was, with Dr. Sell, and it was excellent. And I applaud you for the information you gave the community. Thank you.
Thank you.
Very good. Thank you, Doctor. All right, next on the agenda is the Excel Award. David.
So, Dr. Ura, you're gonna log in to a presentation coming up here in a little bit about the expanding cath lab. Okay, it's coming up in Mission and Plan. You're filling the log, all right? All right. Let's give it a preview for the minutes coming up.
Very good.
Okay, now on to what you asked me to talk about.
Please.
I am happy to introduce to the board our Excel Award winner for February 2020, Marilyn Kirchman. Marilyn, come on up. Congratulations again. You all right? Yeah. Good. Come stand by me. All right, I'm going to say some nice things about you again, okay? Okay. All right. So the Excel winner for February is Marilyn Kirchman, who is an Advanced Practice Program Coordinator for Disease-Specific Stroke Program. That's a long title, isn't it? You got all that on that badge? Ooh, it does. I had to see a microscope for that. All right. Marilyn has been an exceptional employee since she first joined SMH in 1987. Here are several comments from her peers about her outstanding performance. Marilyn's dedication to the stroke program is unmatched. She has a passion for excellence and is actively involved in ensuring we maintain our national DNV certification as a comprehensive stroke center. Marilyn is extremely knowledgeable about stroke and stroke guidelines. She has superior problem-solving skills and is the go-to person for any questions. Marilyn also demonstrates a positive image and is a role model for her colleagues. Patients and families always say how kind and understanding and compassionate she is. She also focuses on transitioning patients from the hospital to home and will go out of her way to direct patients and families to resources they need. Marilyn, it is truly an honor to work with you each and every day, and we love having you here. Congratulations. Okay?
Marilyn, on behalf of the board, we'd like to present you with this plaque. The Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients, families, and the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes Marilyn Kirschman with the Excel Award for the month of February 2020, signed by David Verinder, President, and Bill Noonan, our Chair. Congratulations. The microphone is yours.
I'd just like to say thank you very much for this honor. I've been here for a long time. I've seen a lot of growth and change in the hospital. I've been fortunate to be part of that. It's my home away from home. I have a wonderful team that I work with who, for the last couple of years, has been part of my support system as I've dealt with a diagnosis of cancer, and they've been beside me every step of the way. So I can only say thank you very much, and it's truly an honor to be part of the SMH team. Thank you very much.
Congratulations, very good. All right, next on the agenda is the report of the medical staff. Dr. Schulman.
All right, we have a large number of policies and forms that need board approval. They all come with the recommendation of the Medical Executive Committee. I'm happy to answer any questions about them, and I think Mrs. Wetzler de Peters has a motion.
Yes, I do, and I will list each one of them separately and for approval. First one is the revised SMH Trauma Service Administrative Policy. Next, the revised SMH Trauma Service Organizational Structure. The EP Ablation Privileging Form. The Critical Care Medicine Revised ECMO Criteria. The Face-to-Face Assessment for Violent Restraints Criteria. Neurosurgery Orthopedic Spine Access Criteria. The Subarachnoid Hemorrhage Care Protocol, the Revised Medical Staff Credentials Policy, and the Advanced Practice Professional Scope of Practice Privileging Form, all as recommended by the Medical Executive Committee.
Okay, well done. Do we have a second?
I'd second that.
All right, we have a motion and a second. Any discussion or questions?
Question.
Mr. Henry.
Does this change expand the availability of ECMO to patients who might be having issues with heart surgery?
No, it was really done just to make sure that both cardiology and cardiac surgery were included on this. They always have been, but it was never on paper. That was the actually only real change to that, with just
So
management.
it just doesn't change it?
No, it really is just change of documentation of management. It's actually always been done with both teams, but now
Very
it's
well, thank you.
official.
Okay, we have a motion and a second. Any other discussion? Okay, hearing none. All those in favor of the motion, please indicate so by saying yes.
Yes.
Any opposed? The motion carries. Thank you. Next on the agenda is the foundation report. Mason Ayers.
Thank you, Mr. Chair.
Space continues to fill up for the upcoming Women in Medicine Luncheon. It's on March 27th at Michael's on East. We are planning this year a panel discussion on bone health, and the event will benefit the SMH rehabilitation program. Also, we continue to plan for the upcoming golf tournament, which is on May 1st at Laurel Oaks. And the beneficiary of that tournament is going to be the Physician Education Endowment. That concludes my report, Mr. Chair.
Very good, thank you. Any questions for Mason? Okay, hearing none, we'll move on to the Secretary's report. Tram Hudson.
Mr. Chairman, in the absence of Ms. Reiner, who's the Secretary, I'm pleased to give the Secretary's report and would like to announce that our meetings for the month of March will be on Monday, March the 16th, from 10 to 10:30. We will conduct the SMH Physician Services. That's the first physicians group meeting at 10 o'clock. At 10:30 to 12 noon, the Finance Committee will meet. From 12 noon to 12:30, we'll have a closed session of the Hospital Board meeting. At 12:30, we will review financial statements and finances of the hospital. And at 2 o'clock in this room, we will have our board meeting for the month of March. That's all I have to report.
Okay, thank you, Tram. Any questions for Tram? All right, moving on, Treasurer's report. Joe DiVirgilio.
I just have one item, which is approval of the bad debt and charity care. And in that regard, I move approval of the bad debt and charity care for the month ending in January 31st, 2020, in the amount of $24,911,000.
Okay, thank you. We have a motion. Is there a second?
Second.
All right, we have a motion and a second. Any discussion? Hearing none, all those in favor of the motion, please indicate so by saying yes.
Yes.
I didn't hear you all.
Yes.
Yes.
Any opposed? The motion carries. Thank you. Next, financial highlights. Sitting in for Bill Wojin is Nelson.
This is the financial report for the month of January 2020 and the 4 months that ended January 31st. For the month of January, the total revenues were $96.5 million compared to a budget of $92.9 million. And for the 4 months that ended January 31st, revenues were $354.7 million compared to a budget of $341.5 million. Total expenses for the same periods for the month of January, $85.3 million compared to a budget of $85.4 million. And for the year-to-date period, total expenses were $323,241,000 compared to the budget of $321,263,000. That results in operating income for the month of $11.2 million compared to the budgeted $7.5 million. And for the year-to-date, $31.4 million versus $20.2 million of operating income. Looking at a few statistics, the average daily occupancy in, in the 4 months that ended January 31st, we had 599 actual compared to a budget of 557, and admissions totaled 15,132 compared to 14,631 that we had in the budget. We had a total of 8,351 surgery cases, and the budget was 8,543. Last year, at the same for the same period, 4 months, we had a total of 8,317 surgeries. Total births were 1,370 for the 4 months, compared to a budget of 1,311, and last year, 1,304. There were 162,255 outpatient registrations in the 4 months, and that compared to 163,362 budgeted and 157,750 last year for the same period. We had a total emergency care center registrations of 43,300 compared to a budget of 41,425. And our case mix for the 4 months was very similar to the case mix last year, both for all patients and for Medicare patients. The all patients case mix was 1.78, and for Medicare, it was 1.9. Thank you.
That concludes your report, I assume.
Yes.
Very good. Any questions for Nelson?
Please.
Mr. Henry?
Nelson, what's the effect of case mix? I understand the case mixing means who pays. What's the impact of that?
The case mix is sort of a measurement of the different types of cases that are seen at the hospital, the inpatient cases. It's based on the different types of cases of different case weights. And so the average case mix is just that, an average of all the different types of cases to try to get an idea of the relative, you can say severity or acuity or type, or uses of resources type of measurement.
All right, so the cases are weighted, and then a number's established that says this is going to be a heavy, heavy load.
Essentially, yes.
Okay, thank you.
All right, thank you, Nelson.
Thank you.
Very good. Okay, next committee reports, Mission and Planning, Joe DiVirgilio.
All right, thank you, Mr. Chairman. This morning, the committee, the Mission and Planning Committee, discussed the GI and endoscopy practice at SMH and the supporting construction of physician's office space and an outpatient endoscopy suite that we're proposing at 1852 Hillview Street. Lori Lang introduced the project, which is an expansion of FPG and ambulatory services, aligns with the Sarasota Memorial Healthcare System strategic roadmap. Dr. Jack Rodman, then drilled down and shared the current GI service landscape in Sarasota County, the GI procedures performed at SMH, and the current challenges within the GI specialty, and discussed opportunities and plans to enhance patient access. Frank Morgan then took it further and discussed the current SMH ambulatory network as well as the planned future expansion. He then detailed the construction plans for the GI and endoscopy space, including the financial projections of FPG GI practice and SMH endoscopy center. Lori Lang then explained the related enabling projects that need to occur to allow for the construction at the Hillview building, and went over the projected financial summary and proposed timeline, slating the GI practice and endoscopy center at Hillview for an October 2020 opening. Based on their presentations, I move approval of $12,260,780 for the renovation of the existing 1852 Hillview building to create a GI and endoscopy center and to move the necessary departments to allow for construction as recommended by the Mission and Planning Committee.
Second.
Okay, we have a motion and a second. Any questions or comments?
Yeah, what was the amount again?
12,200,000.
I thought you said 2 million.
I'm sorry. Yeah, it's $12,260,780.
Okay, very good. All right,
Excellent,
so
thank
again,
you.
we have a motion and a second. Any other comments or questions? Hearing none, all those in favor of the motion, please indicate so by saying yes.
Yes.
Any opposed? Motion carries. Thank you.
All right, next up, we heard a presentation from David Patterson regarding the plans for the invasive cardiology expansion. Mr. Patterson began by highlighting the system's strategic roadmap and the invasive cardiology facility and department overview, as well as the growth that the department has experienced over the last 5 years. The planned expansion schedule for phase construction will include 2 additional cath labs, 11 additional pre- and post bays, increased waiting area, cardiology office and storage renovations, and will allow for additional capacity and improve patient and physician satisfaction. Based on that presentation, I move approval of the cost of construction for expansion of the cardiac catheterization lab for a total project cost not to exceed $14 million, $8 million of which is budgeted for fiscal year 2020, and $6 million of which will be budgeted in the fiscal year 2021 as recommended by the Mission and Planning Committee.
Thank you. We have a motion
Second.
and a second. Any discussion or questions? Hearing none?
Discussion, please.
Yes, Mr. Henry.
Thank you, Jim. Correct me if I'm wrong, but I believe Mr. Patterson is doctor, is he not?
No.
If he's not,
No.
I apologize.
He is a
Let us use
PH. I believe he is a PhD.
No, he's a nurse.
it. Let us use it
No.
then.
He's not.
No,
He's
he's
not.
not, he's an RN.
He's a nurse.
He's an RN.
He's an RN.
He's an RN.
He's an RN and I think an MBA.
Yeah.
There we go. All right, any other questions or discussion? Okay, hearing none, all those in favor of the motion, please indicate so by saying yes.
Yes.
Any opposed? That motion carries. Thank you.
And lastly, the final presentation to committee related to the rankings of the architect and engineers and general contractors for the GI and Endoscopy Center at the Hillview Project. Tom Perigo, Director of Architectural and Construction Services, walked the committee through the ranking recommendation. And based on that presentation, I have a motion, and I move approval of the ranking of the following entities for architectural and engineering and general contractor services for the GI and Endoscopy Project at 1852 Hillview, as recommended by the Public Selection Committee and the Mission and Planning Committee. And those rankings are as follows. For architect and engineer, Grisham, Smith and Partners, 1. 2 is PRA Plunkett, and 3 is Besso Design Group. And for general contractors, number 1 was J2 Solutions, Inc., number 2 was Willis Smith Construction, and number 3 is Creative Contractors.
Okay, thank you. We have a motion
Second?
and a second. Any questions or discussion?
Is it too early to ask about timeline, or is it like way ahead of?
You may ask.
Any idea on timeline for construction, or they have any idea about when this would be completed?
Which, one you're talking about?
For the GI lab.
For the GI lab, yes. We, October of,
October, this coming October. we should be
2020.
operational By the end of.
yeah, October 2020. Thank you. Thank you, Lori.
You're welcome.
Any other comments or questions? Hearing none, all those in favor of the motion, please indicate so by saying yes.
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 Any opposed? The motion carries.
And that's all I have.
All right, thank you. Next is the Investment Committee. Jim Meister.
Thank you, Mr. Chairman. The minutes of the September 16, 2019 Investment Committee meeting were approved. Colin Robertson of Northern Trust gave a presentation on fixed income update and portfolio review, which included an outlook on inflation and interest rates. Colin presented information on the board-designated fund investment results of the quarter ending December 31st. The enhanced cash fund had a return of 41 basis points during the quarter and earned 2.78% over the calendar year 2019. The intermediate fund had a return of 42 basis points during the quarter and earned 7.45% for the calendar year 2019. Both portfolios are invested in high-quality securities. No motion is necessary. This is for information only. Tim Sant of Pavilion presented a report on the market environment and the retirement plan portfolio results of December 31st, 2019. The plan assets had a gain of 5.01% during the quarter ended December 31st and gained 17.35% for the calendar year 2019. Our managers beat the benchmark by 15 basis points for 2019. Tim's report included a look at the 3-year portfolio average return. As of December 31st, 2019, the 3-year average return was 8.49%. No motion necessary. This concludes my report, Mr. Chairman.
Okay, very good. Thank you, Jim. Any questions for Jim? Okay. Next is the President's report. David Verinder.
Thank you, Mr. Chairman. I'm going to start today, as we always do, and look at our organizational report card. And we look at the 5 different categories that we consistently report on. The first one is our service category, where we have a system patient experience, our likelihood of recommending. We have a goal of having the number of service areas greater than or equal to the 75th percentile, being 8 out of the 10. Happy to report, as far as I'm remembered, the first time ever, we're actually at 10 out of 10. So big thank you to our staff. While they're having these record volumes and record activity on campus, they're really treating our patients very well. And we're
Absolutely.
very happy
Congratulations
about
to the
that.
entire hospital.
Thank you. In the people turnover, our people category, our indicators, our turnover, our part-time and full-time staff that have been hired within the past 12 months. We have a goal of being 24% turnover or less. Happy to report that we are trending at 22.95%, so less than the goal, which is the side of the goal we want to be on. Quality, we have our indicator is our infection prevention, which is our overall, our combined overall standardized infection rate. We have goal being less than 0.93. Happy to report we are also exceeding that at 0.74. Just to remind the board that the national average or expected is 1.0, so we are quite a bit below where the national average or expected. Finance, you heard our controller, Nelson Lane, give a report on that earlier. Our goal is our organizational finance operating margin. We have a goal of being at 6.5%, which is our budget. We are trending right now at 7.5% is our projection right now for the year. And in the growth section, we have two different goals. The first being our inpatient admissions and observation outpatients. We have a goal of being 46,070 patients for the year. We are trending greater than that at this point at 52,728. The second under growth is outpatient registrations. We have a goal of being 894,882 for the year. We are trending higher than that as well at 960,839. So we look at our patient experience report card a little bit deeper. Good news here is I don't have to tell the board, hey, check out this line that has a bit of a miss. We're all green in both the greater than the 50th percentile and greater than the 75th. So congratulations once again to our departments.
Fantastic.
Thank you. I'll pass that along. Believe me, it means a lot to them. Also happy to report during this past month, CMS came out with its new report card for the nation's hospitals, and Sarasota Memorial is the only hospital in the region to receive the overall 5-star quality rating once again. SMH is the only hospital in Florida and one of just 45 across the nation to have earned the highest possible rating from the Centers of Medicare and Medicaid Services in every reporting period since the program began back in 2016. Of the 4,500 plus hospitals evaluated, less than 9% earned the 5-star rating, and in January of 2020, updated post this week on the CMS Hospital Compare website. So as in previous years, most hospitals received 2, 3, or 4 stars. So congratulations to our staff and the board on that. SMH medical experts in the news. We've got several of them. One of them, Sharon, you mentioned just earlier with Dr. Yayura was here. Our SMH Chief of Cardiothoracic Surgery, Jeff Sell, and SMH Cardiac Catheterization Services Medical Director, Dr. Ricardo Yayura, both spoke about TAVR on a recent ABC7 roundtable. In the center left, we had SMH Infection Prevention and Control Medical Director Manny Gordillo, who spoke on the coronavirus. And in the bottom left, an internal medicine residency program associate director, Dr. Karen Hammond, pictured right, discussed how to live longer and better on SNN. So we are happy that all of our people get out there and do that. Appreciate it. SMH also had physician leader serves as Doctor of the Day in the state capitol. So we wanted to congratulate Dr. Sean Daly, Sarasota Memorial's medical director for anesthesia, who was recently chosen to serve as Doctor of the Day for the Florida Senate. In his special role, Dr. Daly manned the clinic at the state capitol in Tallahassee. Physicians from around the state volunteered to provide a day of care to any ill or injured lawmakers or legislative staff. So congratulations to Dr. Daly on his recognition. I want to update real quickly, and we heard a little bit of update earlier from Sharon Roush, the president of our SMH Venice site, our progress on the hospital in Venice. So the construction on the hospital is on track to top out, which means it's going to reach its highest point in April. We believe we already have that on your calendars. April 2nd, I believe, right, Sharon? April 2nd, so we certainly invite everyone to come to that. The facility is located on Laurel Road at I-75, is on schedule to open in the fall of 2021, initially with 110 private patient suites. We are also closely following our construction progress on our oncology tower. And once again, you heard a little bit of that earlier from our Chief Operating Officer, Lori Lang, who described where we were. But our foundation's work continues to progress towards Waldemere Street, and the work on the elevator and stairwells is beginning. The 8-story facility is scheduled to open on SMH's main campus in the fall 2021. You know, if you happen to be on this campus and you go in the Waldemere garage or in that A elevator shaft and look down on it, it's a pretty impressive sight. So we're very excited about that too. So we're also construction progress on our radiation oncology center. The Cancer Institute welcomed its first TrueBeam linear accelerator to the new radiation oncology center under construction at University Parkway. The facility, which will open in August of 2020, will have 2 linear accelerators. The welcoming committee above included Robert Santos, Kelly Dancer, Kelly Batista, Spencer Leet, and Tina Hall. So we are very excited about this new service that we're able to offer starting in this August. First Physicians Group welcomes a new physician to our Northport office. Sarasota Memorial welcomes a new primary care physician to the First Physicians Group network and the Northport community. Dr. Dennis Charlotte, a board-certified family medicine physician, is now accepting new patients at FPG's Internal Medicine and Pediatrics and Family Practice Office in Northport. Providing comprehensive primary care for families and individuals of all ages. Dr. Charlotte earned his medical degree from Marshall University, where he also completed his residency. HealthFit gets a healthy turnout. HealthFit's recent medically integrated fitness expo attracted hundreds of attendees to the center located off Clark Road. The event featured expert speakers and interactive stations, and we just want to thank all of our staff who volunteered to go out and greet members of the public on that day. As always, we have a number of free lectures that go on, and you can see that list on the right, or you can go online and see them even in easier to read format. This month, it looks like we're concentrating on blood thinners and stroke prevention, TAVRs, and other cardiac issues. We also have the 2020 Heart Walk coming up. All these lectures are free to the public. We just ask that you go online and RSVP so we can get a good head count before they come on. And that is my report, and I'd be glad to answer any questions if there are any.
Any questions for David? Very good. Excellent report.
Thank you.
Thank you. All right, next, consent agenda. Any items? Nothing. Any public comments, Karen?
No, sir.
Okay. And any legal matters? I forgot you last time, so any legal matters?
That's okay, no reports.
Okay, very good. So any other business? Hearing none.
I move we adjourn.
Yep, thank you. We stand adjourned.